different than what we're doing now?
Because you're all operating under one organization, and you've merged everything into one. You've got a battalion chief of EMS that's making sure that everybody, whether they're career firefighters or paid on-call firefighters or paid on-call EMS providers, are all being trained at the same level. It gives you enough horsepower to do quality management, particularly EMS quality management. There's just a whole bunch of different things we think, and it should be addressed in the report, where we think it makes it much more efficient to have everybody in the room.
So most of it is the training issue.
That's just part of it.
Could I
Yes, ma'am.
with that? Would it not also make it more efficient because you might have, as in your proposed adding of staff, you might have a paramedic on an engine, and that might be a closer unit for an EMS call than the ambulance. They would respond first because they were closer as the ambulance is coming, where you would get initial treatment from those people?
Well, not
So that
necessarily.
would
Not necessarily.
help efficiency?
No, not necessarily. There's a growing body of evidence. Really, the systems that work the best and produce the best patient outcomes, and there's a whole bunch of published literature to suggest that, and I'm an ex-paramedic, is that if you have basic life support first responders that are well trained as to provide basic life support, plus are oriented to work with paramedics, you tend to get the best patient outcomes. You know, it was a big thing a number of years ago that, hey, you know, if we have paramedic, we put a paramedic on every fire engine, we'll save more lives. Well, that's not true. Too many paramedics actually on the scene make patients worse. And, you know, I hate to say that, but that's what the research says. And there's other reasons for that. When I worked in Multnomah County, Portland, Oregon, and I had paramedics on every one of my engines, all my truck companies. The ambulance service was provided by a private provider. They had 2 paramedics on their medic units. So I would sometimes have 8 paramedics on a call where what just wasn't necessary. And my medics could not maintain their skills. My paramedics, for example, had 0.52 opportunities annually to do endotracheal intubation on average. They weren't even doing 1 a year. And you can't maintain your skills. You don't see enough patients, you don't do enough procedures, and so there's skill degradation.
So to the Commissioner's question, then, what are you proposing? Because to me, that it seems like you would get better service to the patient if you merge, but what justification are you using to say you would if it's not that you could have a quicker response time or equally trained people on an engine? So what advantage are you
Pure plain efficiency. There's a whole list of things in terms of somebody that has the time devoted to, first of all, you have full-time, you have 2 ambulances. When we first started here, it wasn't working this way. But you would have 2 ambulances at Jordan Allen Heber, staffed 24/7, 7 days a week, with a minimum of 1 paramedic at each station. A true paramedic, not an advanced EMT, and it's not anything against advanced EMTs, but a true Utah certified paramedic. And so that's a gain. Plus you're combining all your training. You'll have enough people to do quality management.
I'm not opposed to it. I wanted an answer for his question if it wasn't, if you were, and that.
I don't know, did I answer your question?
I think so. Now you did.
I'm still a little confused, because you came back and said that, you know, we're merging, but you came back and said you discontinue requirement of hiring EMS and have them have fire 1.
Yeah, I'm saying, okay, what we're saying is first of
that
all,
would appear it's segregating the 2 into different groups,
well, not necessarily.
and would work against the merger.
Okay, what we're saying is first of all, I would go through all my paid on-call firefighters and paid on-call EMS workers. Those people that do not rarely participate rarely are attending training or drills, I would tell them to go. Those people that are like doing it and that are active, I would keep them. Now, but I would eliminate some unnecessary requirements. These EMS volunteers are required to be a firefighter 1 and a firefighter 2. That's a lot of training. When you have somebody like an ER nurse at the hospital or a respiratory therapist says, hey, I want to volunteer on the ambulance, I'd help out. And you say, okay, but you're going to have to become a firefighter 1 and firefighter 2. Even though you're not going on any fires or doing any of that, you still have to do that. Now, for the firefighters that are required to be an advanced EMT, they have to maintain all their skills. We interviewed 3 of them, and I asked them, well, how many times have you intubated somebody? Never once in my entire time here. And these guys have been there 10, 12 years. So we're not saying get rid of those people. We're saying reduce some of the unnecessary requirements, get rid of the people that aren't participating, and keep the people that are, and encourage other healthcare providers like emergency department nurses.
I can see it when it was on-call
Right.
volunteers, but the
Right.
full-time employees,
Yeah, I'm not sure.
full-time employees
What's that?
should have both.
Oh, absolutely. Oh, yeah. I don't want, I'm sorry if you misunderstand what I meant. No, full-time staff needs to maintain their firefighter certifications and their EMS. Absolutely. Absolutely.
It's just the on-call.
Just the on-call. Other questions, complaints? None of what we wrote is cast in stone. You don't have to take our recommendations. You can modify what we suggest. Questions, comments, complaints?
I think this gives us a very good starting point, and
Yeah, please throw those away until I send you the new ones.
it helps gives us a direction. With the help of our advisory board now, I think we put a working model together, and they've already made some short-term recommendations. So I think as a fire board, we need to have a work session with our advisory board and the chief and map out the direction to go. What's feasible and what's possible.
That's all I have, folks.
It sounds like you've already implemented some of the...
Some of them, but I think the advisory board has went through this with a very fine-tooth comb and got some good recommendations that we need to sit down with them and see if we make sure we understand how to go about it and what their directions are. So, thank you.
Thank you for
Appreciate your hard work and information provided.
Okay.